Good evening, everyone. Good evening. Thank you for joining us and welcome to the third installment of the MSK Fossil Group's Reflect, Educate, Celebrate Black History Month series. We're very excited to have you join us tonight. So far, we've been really excited about the attendance response to the series that we've had this month so far. So we thank our MSK community and friends for joining us this month. Today, we are very excited about today's topic around housing, poverty, and race and its impact in public health. We encourage everyone to please submit any type of questions that you may have to the Q&A option that you'll find towards the bottom of your screen. And at the end of today's session, we will have time for a bit of a Q&A session. This week, we will have our last installment of our series that will occur on February 25th at 6. It will be a roundtable hosted by Dr. Michael Patterson with some of our MSK faculty team members. So we encourage you all to join us until the end of this month series. It's been a joy to have everyone's response and engagement. So to kick us off tonight, we have Dr. Clifton Mills, one of our wonderful esteemed MSK providers, who is here to help me introduce our speaker for this evening.
Hi, it's my pleasure to introduce Courtney Anderson. Ms. Anderson is a law professor at Georgia State, where she studies health law, transactional law, affordable housing, and health disparities. Ms. Anderson is particularly interested in pairing economic development with policies that achieve health equity. Ms. Anderson is a fitness enthusiast, successful business owner as well. Ms. Anderson, we're honored to have you. Please help me, everyone, in welcoming Courtney Anderson.
Thank you all so much for the nice introduction and for allowing me to speak with you this evening. I'm really looking forward to this discussion, looking forward to hearing any questions that you might have. I think this topic is really important, and since we're here in Atlanta, I will be giving some examples and discussing some things that are specific to our city, but also trying to understand how these things impact all of our lives on a national scale. So really talking about housing, poverty, race, and the impact on public health. And I really want to focus, just if you want to think about one main takeaway this evening, how all of these things are interrelated. And so it really requires an interdisciplinary approach. So to that end, I'll conclude by looking at some policy and legal reforms that we can take to reduce health disparities that exist in minority communities, to reduce these health disparities that are affecting Black and Brown people at much higher rates, and not just by focusing on simple housing policies, but also taking a look at education, employment, voting, and understanding how public health is so complicated. So it really has a lot of nuances to it. To that end, I'll start by giving a historical overview of segregation and housing. We'll talk about redlining and restrictive covenants mostly, but there are so many things in our history of this country that have contributed to our segregated living patterns today. I'll give a working definition of health disparities. I'm sure most of you are familiar with that term and can think of some examples, especially in light of the pandemic, which has really exacerbated a lot of these health disparities. But it's just going to be a quick overview so that we can understand how housing policies and housing laws really affect health disparities, and how substandard housing causes a lot of health disparities that people are experiencing. We'll take a look at fair housing. And this is a great example of a civil rights act that's very broad and was considered to be very sweeping and transformative when it was passed. And people still point to it as a way to show that there are equal housing standards in this country. But we'll take a look at how fair housing acts, how it compares with some of the affordable housing issues that still persist today. Slightly touching on gentrification and public housing, our voucher system, and how gentrification leads and exacerbates segregation, and further deepen some of these health inequalities before we focus on how we can achieve health equity at the local, state, and federal level by advocating for some changes. So jumping into it, I'll start with redlining and restrictive covenants to give an overview of segregation. And I think the important thing, if you've heard of redlining before, just to understand these weren't private actors. It was really supported and created by our government. And that's why racism is so entrenched in our political system and in our legal system. So when we think about redlining, it's literally what it sounds like, creating specific neighborhoods that are acceptable for banks to give loans, that are acceptable for certain nationalities, certain races to live in. So we decided that some neighborhoods would be labeled as best, still desirable, definitely declining, and then hazardous in red. And we decide these neighborhoods are hazardous based on their racial composition. So in these neighborhoods that are marked as hazardous, we weren't going to provide them with the ability to become homeowners. And once you segregate people, once you make these physical divisions, it's very easy to then disinvest in these communities. And that's why the inequities can become so entrenched over time. In fact, looking at where we decided to label neighborhoods as best, which were predominantly white neighborhoods, 91% of them remain upper to middle class. 85% of the best neighborhoods are predominantly white. And then 66% of the hazardous still remain mostly minority communities. So even though redlining is illegal, we have these de facto laws and policies that still perpetuate segregation. For example, we might see that where we see multifamily affordable apartments, we usually don't see those next to large single family homes. So while redlining is illegal, it's still perfectly illegal to discriminate based on zoning. So you can just designate anti-density zoning. This amount of parcel of land cannot have more than one residence on it. That's perfectly legal. It's perfectly legal then to realize that land that's going to be located by environmental hazards will be cheaper. And so people of low income, which are disproportionately minority individuals, will have to live by those environmental hazards. So we still have factors that create segregation, and we'll talk about that in the context of the Fair Housing Act later on. Restrictive covenants are another element which are outlawed. Restrictive covenants are definitely illegal. Got rid of them years ago through the Supreme Court. But when we had restrictive covenants, this is an example right here, very pointed, saying that no part of the property or any portion thereof should be occupied by a person not of the Caucasian race. And so really specifically saying we do not want any people of color living on these lands, making it illegal to transfer or sell land to these people of color. But even though restrictive covenants are illegal and redlining is illegal, we see that US home ownership rates by race still have these disparities. So if you take a look at this graph, you'll see from 2016 to 2020, not much has changed over the years. So you can see that Black is represented by the darker blue, then Hispanic, Asian, and then white by the lightest blue. So you can see that there are racial disparities with respect to homeowner rates in the United States, in large part due to these historic, illegal, discriminatory policies and laws that were supported by our government. As a result, we have segregated living patterns. And therefore, when we look inside of these environments, there are certain environmental factors that contribute to poor health and perpetuate chronic illnesses in communities of color. And when we talk about these health disparities, the key thing, I think, in this definition is that preventable differences. So these are preventable differences in the burden of disease and opportunities to achieve optimal health experiences by socially disadvantaged populations. And so if they're preventable, why do they still exist? They exist alongside racism and all of these other inequities. So these are health disparities that exist regardless of people's insurance, regardless of people's access to healthcare, their ability to pay for doctors, their ability to go to hospitals. They exist in spite of income. The only way these differences are explained are because of socioeconomic factors, mostly race. So if you're looking at these socioeconomic factors and you look at it from an income and a race perspective, you see how they tend to reverberate and become larger when we have disproportionately high communities of color who are also low income. So low income individuals have disproportionately high rates of obesity, asthma, and other illnesses, particularly chronic illnesses. All of these things rely on preventative healthcare measures. And if people are able to achieve these preventative healthcare measures, we wouldn't see people dying of these illnesses needlessly. Another example of a health disparities despite income, when you look at the gap between white and African American infant mortality rates, it's greater today than it was in 1950. And that's not explained by an income gap or the ability to pay for doctors or hospitals. It's attributable to race. And so there's no need for this type of disparity. So what can we do if it's preventable? How do we take the steps to prevent it? If it's not as simple as providing someone with insurance or taking someone to the hospital, there's more to be said about race relationships and how it's contributing to these health disparities. Additional examples are particularly prominent as we go into looking at housing and how it contributes to health disparities among children. But when we look at the higher rates of diabetes, Black children having higher rates of emergency department visits. So looking at preventative care rather than seeing primary care physicians, the ability to treat diabetes early, the ability to receive preventative care to address some of these lifestyle issues that can stave off diabetes. We don't have these same opportunities based on socioeconomic factors. And especially looking at asthma, asthma is attributable oftentimes to environmental hazards in the home, schools, churches. So if we decide to segregate people and have people living in substandard buildings, then you can see how this type of health disparity is exacerbated among these communities. These are additional health disparities looking at the contraction of cervical cancer, and also looking among American Indian and Alaska Native adults, looking at them being diagnosed with diabetes at higher rates. And it's not just the diagnosis and having it, even if you're looking among communities who all have it, regardless of their race, why are people of color dying at twice the rate of white individuals with diabetes? So it extends to all the continuums of the disease. And I'll just show a couple of examples of how some of these health disparities are really taught. This is from the textbook of basic nursing, a textbook that was revised to address some of their discriminatory language, but stating such things how Asians might not like having their blood drawn because they consider it their body's life force and doubt that it can be regenerated. So just these sweeping racial statements that will make people hesitant to provide basic medical care to someone based on their race, based on their nationality, or these other factors. Students focusing on communicating non-verbally with their patients who are African American. So understanding how the communication breakdown can be assisted even further by these discriminatory actions when patient and physician relationships can often be fraught when race is introduced into the dynamic. This 2016 study from the University of Virginia points out a lot of people's racial bias, implicit or otherwise, that exist, thinking that Blacks age more slowly than whites, they have thicker skin, or their nerve endings are less sensitive. And of course, when you look at the development of modern medical practices such as gynecology and its reliance on these same type of stereotypes to perform medical research experience on Black women, especially without pain medication, without proper procedures, a lot of these racial biases tend to persist in present day, though it may seem as though something that's concentrated in the times of slavery. The racial biases still affect how we interact with one another and how patients are perceived when they're patients of color. And insurance, again, doesn't really solve all of these problems because it's not just access to care, it's how you're treated once you're in the care of someone else. So why do we see these disparities of receiving less diagnostic evaluations and post-treatment care or being denied pain medication based on your racial identity? So when we know that these health disparities exist, we have to really understand the structural racism that permits us to thrive from these biases and allow certain individuals to attain benefit from the type of race disparities, which can be often not really addressed in communities of color for cultural reasons, or because in the hierarchy, they just don't really see it as a priority given all of the expected stress and expected obligations that they have to carry day to day. But looking at some of the physical health disparities that result from poor housing conditions, these are all these conditions that impact school performance. So as I mentioned, these problems are very interdisciplinary. Housing issues are really tied into education issues. Education, public schools are funded on property taxes. So the wealthier neighborhood that you live in, the wealthier school your children go to. If your children live in a home already that's substandard, they're going to experience illnesses that make it harder for them to concentrate in school and to achieve graduation and other academic milestones, primarily based on their income. So being exposed to lead, mold, allergens, all of these things lead to cognitive and behavioral deficits that are attributable to lower levels of academic performance or that contribute to absenteeism. And then when you look at absenteeism, often then the parent will get blamed if a child is absent too many times from school. And furthermore, it can affect the recipient from getting social service benefits, such as temporary assistance for needy families or other cash assistance if their child is absent or truant from school too many times. When you look at mental health, it extends beyond just the mental health of the child, but also to the parent, all of the guardians, because the stress of not being able to properly care for your home or living in a segregated neighborhood and generally being inundated with racial stressors can affect mental health. And so not only can it provide increased psychological symptoms and less task persistence for the children, but also parenting skills are compromised when you're living under the stress of racism and in poor housing conditions. As I mentioned, we have the Fair Housing Act, which was really seen in 1968 when a lot of civil rights acts were being passed as a way to truly create integrated living patterns and to just put an end to racial discrimination in housing and land use. The Fair Housing Act has a couple of significant parts. Not only does it serve to reduce and says that it's illegal to discriminate in the housing acquisition process. So in lending, renting, home ownership, really just making it clear that the home acquisition process should remove all type of racist bias. But also it says in section 3608, we want to do more than just eliminate bias, but we want to affirmatively further fair housing. So all of these departments, agencies, local governments, state governments, anyone who receives federal funding for housing programs, which is pretty much every locality, they have to use those funds to promote activities that affirmatively further the purposes of the Fair Housing Act. So it's important to understand that we thought it was important enough to create integrated living patterns and also to promote and progress with affirmatively furthering fair housing. So it's important to look at when we don't do that, we have these widespread health impacts, although this mandate is in place. It was not until 2011 when we really kind of focused on how we're going to affirmatively further fair housing. So what are we going to do to proactively make sure that we're creating these integrated living patterns, since segregation today is worse than it has been ever? So the government at the time really identified these critical neighborhood assets. So assets that all neighborhoods should have, schools, really trying to figure out how we can lower the poverty rates, having labor market engagement, job accessibility, looking at how we can reduce health hazard exposure and create proximity to transits. And so understanding how these assets can benefit neighborhoods, and we want to give localities, governments, the ability to measure neighborhoods' response to assets and their tracking with respect to placing these assets in underserved neighborhoods. But when we look at how this has actually played out, nothing has been done since the last administration to really entrench this rule. In fact, it's been overturned. So we're starting at square one again with even just measuring how we're doing with achieving progress to putting assets in these neighborhoods. So we haven't, although we have this kind of large vision of affirmatively furthering fair housing, there hasn't been an action plan put in place to achieve this at the local, state, or federal level, although the recognition is there that it's absolutely needed. And we can see this through our dearth of affordable housing. We have 34 units of affordable housing for every 100 households in need. And these are households that are living in extreme poverty. So there are other households, especially given the pandemic and challenges of today, that would benefit from housing cost reductions, but who are still just unable to find affordable housing. The largest provider of affordable housing are low-income housing tax credits, and that provides private developers with subsidies for creating affordable housing. So they create affordable housing, apartment buildings that have to remain affordable for at least 30 years in exchange for a very favorable reduction in their tax liability. So these tax credits are very competitive, and so we've kind of outsourced providing affordable housing to private developers, and that can have some of its own challenges. One of the ways we decide who to give the tax credits to is by creating these qualified allocation plans that outlines our cities, our states' priorities with respect to which developers we should give these tax credits to. Maybe we want to prioritize developers who are building their units in integrated neighborhoods or by schools, by hospitals, all of these things that we've identified as neighborhood assets. So we all have the opportunity to push our representatives to create a qualified allocation plan that matches the priorities of housing that you think are important, which can ultimately reduce health disparities. But when we look at housing today and how affordable housing is achieved and how segregation looks, we still see that segregated living patterns truly persist despite this claim that we are to affirmatively further fair housing. This graph on the screen shows that high-income Black owners live in low-income neighborhoods at much higher rates than high-income white borrowers. So we see that despite income, we still have segregation. We still have Black homeowners that are making a high income living in low-income neighborhoods. Same thing with moderate, same thing with lower income neighborhoods and higher income neighborhoods. So it's just not achieving the level of equity based on income. So again, we have this racial factor introduced to the home ownership process. And it's even more pronounced in this graph that shows the neighborhood racial profiles for average white and Black residents. So from 2000 to 2017, you can see that in the darker green color, that's whites, Blacks represented by purple, Asians in dark pink, Hispanics in light pink, others in gold. So again, looking at the whites in the dark green color, you can see the average white resident lives in a neighborhood that's about 72 to 79% white. The average Black homeowner lives in a neighborhood that's 52 to 45% Black. So we still have segregation despite income. Race is still a really big driving factor as to where people live. One of the reasons for this is because of the ability for people to find affordable housing and general segregation tactics that are really entrenched from redlining and restrictive covenants. So before we had the Section 8 housing vouchers, we had public housing. So public housing first was actually developed here in Atlanta. And so the government was responsible for crafting these large housing structures. And the point of these housing structures were to be workforce housing for white employees. But over time, they became mostly resided in by people of color. And it was, not that long until we decided that having these large buildings for affordable housing was not a good idea for the government to run because we're concentrating poverty. We want to have more integration. So what we'll do, just like you see how we have transferred low-income housing tax credits to be put in the hands of private developers, we're going to outsource our housing from the public government function to private people. So we'll give people vouchers, and what we'll do is allow them to choose where they'll live. So they'll just use their vouchers, which is a subsidy provided by the government if you qualify, if you're low income, that will go towards paying your rent. The problem is that you have to be accepted by the vouchers by landlords. And so the landlords are under no obligation to accept your housing choice voucher if they don't want to. So we'll take a look now at what happened when some of these housing projects were destroyed and what happened when we passed out the vouchers with respect to where people are living. Techwood Homes is the very first public housing. It was built in 1936 and it's now Centennial Place today. So all of these public housing structures were demolished, and they were done so mostly under the Hope 6 program, which is a government program to build mixed income housing. So rather than having a structure where you had to be low income to live, we want people of all incomes to live in these structures. However, Hope 6 did not have a one-for-one replacement mechanism. So if you have a one-for-one replacement mechanism, if I tear down 300 units of low-income housing, I have to build 300 units of low-income housing. Hope 6 did not have those requirements. So in this new structure in Centennial Place that you see, there's not enough room for people who were living in Techwood homes. And this was repeated throughout the city, duplicated in pretty much every city in America. Overall, in Atlanta, over 15,000 households were relocated. It's called the Atlanta model because other cities soon followed suit to pursue this mixed income housing model with the hope that it would create more integration, but had the effect of just really hastening gentrification because we're physically removing the homes where people who had a low income could live. And so now they're displaced. And after they're displaced, we're now investing into nicer home structures and attracting equity from business and other entities. So if you received your voucher, where can you use it in Atlanta? On the left shows a map of where people are using their voucher housing in Atlanta. So the darker the color, the more saturated the neighborhood is with housing vouchers. And that's the graph on the left. The graph on the right shows neighborhoods that are majority white in gray and majority Black in blue. Please try to keep these maps in mind as we go through some other maps to show really how housing is tied to other sectors of our lives. So you can see from this map that pretty much you're going to get 0 to 1% housing in the north part of Atlanta, which also, if you look over here, is predominantly white. Down at the south, especially southeast corners, that's where we see majority Black neighborhoods, and that's where most of the housing vouchers are being used. So despite the attempts to create integration with the housing vouchers, it just so happens they're only being accepted in these minority communities. Furthermore, these triangles in yellow were the former housing projects. So they're still saying around the same neighborhoods that had this disinvestment, but we don't have the type of integration into other neighborhoods that we would like to see. Keeping these maps in mind, you can also see where Atlanta's employment is. So over to the graph on the left, the darker the color, that's where we're going to see more employment opportunities. The lighter the color is less employment opportunities. So in that same map that was majority white, we see much more employment opportunities compared to down here, Southwest, where we see very fewer employment opportunities where it was majority Black. Overlaying this now on the shares of homes that are affordable to families earning below 80% AMI, where you see these lighter colors, this is where we have very few percentage of homes that are going to be affordable for families earning below 80% of the area median income, or AMI. Where they can live is down here. So down here, we have majority Black, you have the ability to use housing vouchers, but we don't have a lot of employment. In the majority white areas where you cannot use housing vouchers and that's not affordable, that's where all of the jobs lie. So we can see if we're talking about health disparities and how these socioeconomic factors such as transit, such as employment, education, which is tied to housing, are all causing these health disparities, creating segregated living patterns, really exacerbate these health disparities. And furthermore, when you look at political power, it can have positives and negatives with respect to this segregation. So not only do we have segregated housing patterns, school districts, but also it creates different type of voting blocks. So keeping in mind, if you remember the last Atlanta election, in the majority Black neighborhoods, that's where Keisha Lance Bottoms received most of the votes compared to Mary Norwood and Kathy Woolard in these other areas. So once you're able to segregate people, you can really kind of control their political power. And since this election, and since the last presidential election and the one before that, we've seen a lot of voter suppression tactics that are really targeted by neighborhood. And because we're so segregated, it works across racial lines very efficiently. And so with this type of displacement from really explicit overt acts from Hope 6, not having one-for-one replacement, redlining, restrictive covenants, anti-density zoning, we're able to remove people from their homes, but also generally as we have this removal process, you see property taxes increase when we put in structures such as the belt line that remove people from their homes because the property taxes increase and are no longer able to live there because of that, or the landlord can increase their rent. And also generally when you have a cultural shift in the makeup of the neighborhood, maybe the social networks change and original residents are not really comfortable living in those same neighborhoods. This really results in an equity imbalance. And the more we see mobility, especially these involuntary movements where people are displaced and they don't want to be displaced, we have disruptions in their physical health status, their mental health, and really detrimental impacts on a child's academic performance when they have to leave schools in the middle of the school year. And so when we talk about achieving health equity, we want to understand how health disparities can be addressed through housing laws and policies, what systemic reforms are needed in other systems outside of housing in order to holistically address these health disparities. And this quote from Scott Burris really emphasizes the importance of laws and policies in thinking about health disparities, saying that there are two important ways that the law interacts with social determinants. First, helping to structure and perpetuate the social conditions that we describe as social determinants, and also acting as a mechanism or mediator through which social structures are transformed into levels and distributions of health. So really understanding that the law can structure and perpetuate these social conditions, so that can be good or bad, depending on what conditions are perpetuated. And also we can transform these social structures and distribute health more equitably if the laws and policies are structured in a certain way. So these are just some policy and infrastructure reforms to think about as we think about how we can create more health equity, focusing on housing policies and policies related to housing. With funding and resources, having transparency in what funds we have, where they came from, and how they'll be allocated. If we have an affordable housing fund, what are the funds going to? What percentages are going for direct assistance versus administrative assistance? If we have local vouchers to support the federal program, are those being funded in a way where anyone who wants a voucher can get one? Right now, we have a huge shortage of vouchers and a waiting list for up to 5 years to even receive a voucher. And also, what are we doing to preserve affordable housing? In addition to having low-income housing tax credits, are lands being set aside in community land trusts or otherwise being affordable? Community land trusts will help you acquire vacant property that's been blighted, property that's been abandoned by tax investors, in order to make covenants that require that affordable housing to remain affordable for decades. Understanding what we can do to have inclusionary zoning. So what kind of zoning can be put in place so that we have more integrated living patterns, and we're not just forcing these multifamily structures into low income communities of color, but having them have the same neighborhood assets as higher income units. Source of income protections, that would help with vouchers being accepted on a wider scale. So vouchers aren't responsible for further segregating people based on race. The ability for tenants to have assistance with respect to legal counsel, or to even be educated on their rights as tenants to stave off evictions, would be extremely helpful in keeping people in their homes and allowing them to advocate for their own rights. Providing down payment assistance would help with these home ownership disparity rates that we see, and generally equitable development that doesn't just focus on displacement, and it has anti-gentrification measures such as rent controls in place, so we don't see people having to move out of neighborhoods repeatedly. We also have overlap between the criminal justice system, understanding how arrest records, conviction records can stop people from getting vouchers, can stop people from getting public assistance or employment, which are all things that will affect their housing situation. The over-reliance on property taxes for public school funding helps to generate a cycle of poverty that puts children at a disadvantage. And understanding from a healthcare system perspective, how we can create medical legal partnerships so that some of these health factors that are attributable to legal issues can be more holistically addressed, so we don't see repeatedly people going into the hospital because of mold that's in their homes, we can address the issues by getting rid of the mold and making sure that the landlords follow building codes. What we can do to advocate for Medicaid expansion to generally increase healthcare access, and creating more racial and ethnic diversity within the healthcare system to understand how all these health disparities go beyond just healthcare access, but are in other policies such as housing, education, the criminal justice system, employment system, and our voting system would all go a long way to create the policy and infrastructure reform that we need to create health equity. I will stop there. I'd be happy to take any questions you all might have.
Thank you so much, Courtney. This is a plethora of information, a lot of great information. We really appreciate you sharing this with us. We do have a few questions. Hold on one second as I situate my screen here.
Would you like me to stop sharing?
No, you're absolutely fine. So we have one of our attendees asked, of all the policy and infrastructure reform systems that you mentioned, which do you think would be the most effective for us to concentrate our efforts on?
That's a really great question. And it's hard because the issues are so complicated that it really involves so many different points of access. But I think that if we can look at transparency in funds and allocation, that will help the information to be more attainable for the masses. So if you're not really into housing policy, and that's not what you do day in and day out, still understanding the budget and how funds are being allocated, you can see how much of our tax dollars are being spent towards affordable housing. So I think having transparency, and also it will alert our elected officials that we understand the issue, we've flagged it as important. So I think that will help with policy reform moving forward. If I had to give a second one, advocating for a right to counsel and funds for legal aid tenants, because the eviction process can be very expedient in many states, especially Georgia, and especially with the eviction moratorium that's ending due to COVID, I think we'll see a really high rise in the eviction rates. So providing some protection for tenants in place to negotiate so they don't get removed from their homes would also be helpful.
Awesome, thank you. That leads to a second question. As far as you mentioned, for those who are not maybe in that realm of real estate, there are so many different starting points to tackle when it comes to trying to make an impact and to do something for one's neighborhood. Are there some recommended resources that you would provide to individuals, whether it's a link or a website of what's a good starting point for them to understand what are the current laws in place and how they can start making an impact?
Yeah, I think starting very local is what I always suggest, because housing, although there's federal funding for housing infrastructure that comes in, it's really made at local levels. And so local housing authorities and local building codes, statutes, that's really where I would start, is just understanding what are the building code requirements? What are the tenant rights? What are the landlord rights in your own jurisdiction? Because it can be very, very different from city to city, and even neighborhoods can have their own restrictions. So I suggest looking up, they're all available on the internet. If you just look up your city and building codes to make sure that building codes are being enforced, and what are the rates of building code violations? Have they been fixed? Have they been addressed? That is really helpful. Another entry point is focusing on education. If looking at building codes and statutes is not really interesting to you, there should be a connection between our local public schools and housing, since we have such a connection to property taxes to fund these infrastructures. So public school officials should be aware of housing issues that their students face, and to make sure that they're doing what they can to address the needs of these hypermobile students who have to move all of the time. So just asking your local school officials what they are doing to address children who might be experiencing homelessness or who are suffering from displacement, that's also a way to be an advocate for low-income students.
Awesome. And we do have some of our team members out there that hold real estate license and things of that nature. What are some steps or some support that those who are within the real estate industry, what are some of the things that they can do to assist those who may not know anything about what's out there to assist them to get into some of the neighborhoods that are segregated right now?
Oh, sure. I think every neighborhood has neighborhood planning units. And so going to the neighborhood planning unit meetings, asking if you can talk, just like, can I speak in the middle or at the end of the meeting for 10 minutes just about your neighborhood and what's going on in your neighborhood? What permits have been issued for what type of businesses in your neighborhood? That's something that's really helpful. Those types of permits have to be, sorted out and purchased in advance. So they'll be privy to that information, and just informing communities who don't have the time or ability to access that. What's being planned in your neighborhood? Do you know that this is being demolished? Do you know that they're going to put a parking lot, in the park? So things like that, just to keep track of development and inform the neighborhoods at a community level is really helpful.
Awesome. Thank you so much. And I do have a question for you. When it comes to some of the impacts that you've made and with Georgia State University, I did notice that you helped in leading the development of some of the courses there, the bioethics course at Georgia State University. How did you, what prompted you to start the course, and how did you gain buy-in to have it established?
Oh, sure. I really like that course. I think it's really important. And it's a course that I co-teach. It's an honors course at the undergraduate level. It's held in the law school, though, when we have classes in person. But I co-teach it with the dean, Leslie Wolf, and also Professor Lombardo, Paul Lombardo, who is a bioethics expert. And so what we wanted to do was get minority students interested in bioethics, regardless of what field they ultimately go in. So some are interested in going into medicine or neuroscience or being biostatisticians. Others are going into theater, accounting, business, computer science. But the point is that we have a bioethics framework that the healthcare industry really thought was important in establishing patient rights and advocates for patients. So how can we take that same patient-centered approach and apply it in other areas of our life? So we look at bioethics through a social justice lens to see when we see a problem that's based on some socioeconomic determinants and that's causing an issue of social unrest or that's inequitable. If we apply a bioethics framework, how can we form a solution to that problem that really gets at helping those who are mostly marginalized by this issue? And we received a grant from the Greenwall Foundation to develop and teach the course. And the Greenwall Foundation is very focused in bioethics and wants to expand the diversity of professionals in the field. So our goal is just to introduce bioethics to these students in a way that interests them and that they can relate to. So it was really helpful in presenting the idea, just understanding that we're not just limiting this to people who are interested in medicine, but we really want to apply it from a social justice perspective to a wide variety of students.
Wonderful. We have another question where they said he covered a lot of ground. Thank you. If we wanted to find out more info about health disparities and social determinants of health, do you have any good resources for us?
Oh, sure. The CDC website, and there's this report, Unequal Treatment. Unequal Treatment was kind of like the flagship publication for health disparities. The CDC website also has some guidance. I would definitely start with those two places. I feel like these days there are a lot of articles and reports as we are looking at how the COVID vaccine was developed and how it's being distributed. We're seeing, a lot of inequities with respect to race. So I think also just some recent articles looking at vaccine distribution. And one was just a vaccine distribution article by Dr. Bernard Lowe and Dr. Monica Peak. That recently came out, and I definitely suggest reading that, just because it's something that we can all kind of identify with, and probably things we've seen with inequities in the COVID vaccine distribution. So those would be some good resources.
Awesome. I'll have to connect with you afterwards to make sure that I get all of that information
Oh, sure.
it out. Thank you so much for your time.
Thank
Are
you.
there any additional points that you would like to leave us with before we bid everyone good night?
I just really thank you all for your interest. And I know that's a lot of information. It covered, a lot of different areas, but I hope you can find something that connects with you if you're looking to learn more. Just really understand if you're interested in criminal justice, environmental issues, transportation issues, it all is affected by housing and therefore is going to relate to public health. So an entry point really should be at your interest level and something that you're familiar with.
Thank you. Thank you so much, Courtney. And thank you
Thank
everyone
you.
for attending. We hope that you have a great night. And don't forget, February 25th will be our next and last installment for this month's Black History Month series. Thank you.